Hi, my name is Susan Webster and I'm the Head of Policy and Campaigns at MND Scotland. I'll discuss today how MND Scotland influenced the development of Scotland's new social security system for the benefit of people with MND. From 2017 until the summer of last year, MND Scotland successfully ensured that all people with MND in the country would be fast-tracked for government financial support, without face-to-face assessment and at the highest amount payable. I'll go on to explain that we achieved this by influencing and mobilising the Scottish Government, MSPs, civil servants, third sector, clinicians, the media, and of course people affected by MND. So as we all know, MND progresses incredibly quickly. Yet MND Scotland's financial support team found that people with the illness were waiting far too long to receive their Social Security disability benefits. This was because legislation, the UK Welfare Reform Act 2012, stated that people with a terminal illness should only be fast-tracked for these benefits if they could prove they had just 6 months left to live. However, many people with MND were not being fast-tracked for the benefits because the unpredictable nature of MND meant that clinicians could not be sure when they were in the last 6 months of life. Many clinicians were reluctant to sign off the necessary government forms, and some of those who did found themselves quizzed about their medical opinion by Social Security staff. In fact, research showed that 90% of those who were fast-tracked had a cancer diagnosis because the last 6 months of life was much easier to predict. This meant that many people with MND found themselves battling for the financial support they were entitled to, with some tragically dying before they received it. In 2013, 10 years ago, we lobbied the UK government to try to get them to improve the situation, but unfortunately we were unsuccessful. So an opportunity presented itself to us just a few years later. Devolution in Scotland began almost 25 years ago and allowed the new Scottish Government to legislate in many important areas such as health, housing and education. However, following the unsuccessful 2014 Scottish independence referendum, in 2016 a number of other areas were devolved from the UK to the Scottish Government, including the disability benefits people with MND were failing to be fast-tracked for. New legislation would be necessary to transfer these powers to Scotland, and we knew that this presented us with a unique opportunity to improve the situation for people with MND in Scotland trying to access disability benefits. In 2017, the Scottish Government introduced to the Scottish Parliament its draft legislation, the Social Security Scotland Bill. We were disappointed to see no mention of fast-tracking terminally ill people. We had been expecting to see this because it had been included in the UK's Welfare Reform Act. Colleagues from another charity, Marie Curie Scotland, who support people with all terminal illness, shared our view on this. Working in partnership with them from that point, it soon became clear that the Scottish Government wanted to keep the problematic 6-month rule. The reason given for this was that the Scottish Government wanted to ensure a smooth transition from the UK Government social security system to Scotland's new system. Both our charities believed that this approach had no place in a new system, which was promoted to be based on fairness, dignity and respect. So together, we set out to ensure that a fair definition of terminal illness for social security purposes, based on clinical judgment rather than life expectancy, was included on the face of the bill to protect the people that we supported. As the bill started to work its way through Parliament, we met with the Scottish Government Minister responsible, but she was not for changing her mind. However, at that time, the Scottish Government was a minority government, so we knew there was an opportunity to influence opposition MSPs. In particular, we worked with the MSPs on the Social Security Committee of the Scottish Parliament, whose role it was to scrutinise the draft bill. We made sure the issue was highlighted in their initial committee report. Opposition MSPs were in a slight majority on the committee. One MSP was prepared to lodge an amendment to the draft legislation, defining terminal illness as 2 years life expectancy. We had wanted no reference to life expectancy at all, but as this was a significant improvement from 6 months, we agreed. This amendment was passed by the committee, despite the Minister calling on them to vote against it. However, unfortunately the government introduced a counter-amendment to the legislation, defining terminal illness as the last 6 months of life. Continuing to work with the government and opposition MSPs as the bill progressed through Parliament, we sought to secure support from a wide spectrum of others, using a range of public affairs and PR tactics. These included clinicians. We drafted a public letter of support for our position, which received 60 signatures from prominent clinicians, professors, academics and GPs. We planned media activity around our letter of clinician support and timed this to coincide with the government's publication of its amendments and clinical evidence. We offered our letter as an exclusive to the Times Scotland newspaper, achieving front page and editorial coverage. We went on to secure broad media coverage, including newspapers, TV, radio and social media. From the beginning, we secured the support of 19 key third sector organisations, including many health and rights-based charities who added their logos to our parliamentary briefings and shared our social media posts. We launched a direct action public engagement campaign at the same time as our media activity. We reached out to both charities' supporters, asking them to email their MSPs to support our call for a fair definition of terminal illness to be included on the bill. Over 3,000 emails were sent to all 129 MSPs in just 24 hours from our supporters, and we promoted it extensively on social media. At the same time, we continued to work with MSPs and the Scottish Government. We spoke with the Scottish Government Bill team to discuss the issue and what could be done to change it ahead of the final parliamentary debate and vote. The leader of the opposition raised the issue for us at First Minister's questions, and the First Minister replied that the Scottish Government was considering the issue. At risk of losing the vote, the Scottish Government introduced a final amendment with a definition of terminal illness based on clinical judgment, with no reference to life expectancy, what we had campaigned for at the beginning. The bill passed unanimously on the 25th of April 2018. However, much work remained to be done to ensure that what had been secured in legislation was delivered for people with MND in practice. The Scottish Government asked the country's Chief Medical Officer to produce guidance for clinicians who would be required to follow this new legislation and fast-track terminally ill people for their social security benefits. MND Scotland and Marie Curie were invited onto a multidisciplinary working group of clinicians, charities and civil servants to help produce the guidelines. This, however, was not a smooth process, as not all civil servants welcomed the legislative change. However, working together for many months, we produced clinical guidance which everyone was happy with, and this was published in 2021. The CMO's guidance then had to be put into practice. We were included in the Scottish Government's National Implementation Group on Terminal Illness, which was set up to implement the guidance effectively. This working group included the new agency, Social Security Scotland, clinicians, charities and civil servants. These were new disability benefits, so complex processes had to be put in place for the agency staff delivering them, as well as the clinicians completing the medical forms. It was particularly complex because some social security benefits people with MND would claim were still delivered by the UK's Department for Work and Pensions, so it was critical that the two systems worked well together. All of this was hugely important not just for people with MND, but our own organisation's financial support team, who has helped those with the illness to access the benefits they were entitled to from both agencies. In 2022, adult disability benefit, which would be claimed by most people with MND in Scotland, was tested in a number of pilot areas across the country. The effectiveness of the new Chief Medical Officer's guidance would be assessed alongside this. Then, in the summer of 2022, adult disability payment was rolled out right across Scotland. Finally, people with MND and other terminal illnesses would be fast-tracked for their benefit without face-to-face assessment and at the highest amount payable. So ultimately, the biggest impact of all this change is that people with MND and their loved ones are no longer fighting for the financial support they're entitled to. Importantly, clinicians are no longer quizzed about their medical opinion by Social Security staff, meaning they can have the confidence to sign the necessary forms, knowing they're not going to have to justify their decision to agency staff further down the line. MND Scotland continues to campaign on behalf of people affected by MND to ensure they get not just financial, but all the support they're entitled to, without delay, so they can spend the precious time they have left making memories with loved ones. Thank you.
Thank you, Susan, for that excellent presentation, and I believe she's listening. Yes, there she is. Okay.
Hi.
Hi, Susan. I will open the floor again for questions from the audience. We have one here. Gethin.
Thank you. Gethin Thomas from MND Australia. It's a fantastic result for advocacy there. Were there any conditions imposed upon the forms of MND, or was it had to be ALS, or did it include even people with slower progressing forms?
No, it was all people with MND. In fact, it was really a win for people with all terminal illness. So it was terminal illness that was included in the legislation rather than MND specifically. So that was the main reason that we worked with Marie Curie, because they cover all. So whilst, as I mentioned, that some people with terminal illness, some terminal illnesses were automatically fast tracked, people with MND tended not to be. So that was the key change for us. But as I say, no, there was no specifications in terms of types of MND at all. Basically, at the end of the day, if your clinician decided that you were terminally ill, you would be automatically fast-tracked. That's all you needed. There wasn't any qualifications associated with it.
Okay, so the qualification was, it wasn't that you had MND, it's that the clinician says your disease is terminal.
That's correct,
okay.
Yes.
Cool. Thank you.
So we still have time. Do we have more questions? Kathy?
Susan, quick question for you. If you were going through the process all over again, is there anything you would do differently?
Oh, what a good question. I'm not sure that I would, actually. Which maybe sounds a bit vain, but
Everything was perfect.
It was one of probably in other areas of work there's things I would do differently, but that just I think there was a lot of strength in working in partnership, and I can't really kind of overemphasize that, to be honest, because it just gave you the confidence from the beginning to the end that you were doing the right thing. Because you kind of had each other's support. So, to be honest, I don't know if there is anything that we did differently. I think we threw absolutely everything at it, particularly in the latter stages. As it went through Parliament, it went incredibly fast. So it was really almost like a 24/7 campaign in the latter stages. We were just working on it all the time, relentlessly. And we couldn't take our eye off the ball as well. We just had to be massively on top of it in terms of what the government was doing, but also covering all of our bases with MSPs, the media, our supporters, the clinicians, everybody. So probably not. No, I don't think there is actually anything that we would do differently. But good question.
Do we have any other question for Susan? That's it. Okay. Thank you, Susan, for that excellent presentation.
Thank you.